I can't give you anything but love, baby. That's the only thing I've plenty of, baby. Dream a while, scheme a while, we're sure to find happiness, and I guess all those things you've always pined for. Gee, I'd like to see you looking swell, baby. Diamond bracelets Woolworth doesn't sell, baby. Till that lucky day, you know darn well, baby, I can't give you anything but love.
Hi, and welcome to the Dr. Love Show. I'm Dr. Love, a matchmaker and a love counselor in New York, Los Angeles, and most recently, Miami. Today's episode, I want to talk about sex. I want to talk about straight sex, I want to talk about gay sex, and I've most recently been introduced, not literally, but to transgender sex. So I want to explore that as well. And I have chosen a wonderful group here to join me to help explore the art and the topic of sex. So let's go ahead and all introduce ourselves. Let's go ahead and start with you, Dr. Serena.
Hi, my name is Dr. Serena Goldstein, and I'm a naturopathic doctor here in New York City, specializing in naturally balancing hormones. So I utilize herbs, nutrition, and homeopathy to not just treat, but to get to the root cause of disease.
Awesome. And how about you, Lam?
Hello, my name is Lam, and I'm a singer and an actor. In New York City, I sing jazz, and sometimes I do voice coaching.
Awesome. Thank you for being here.
Thank you.
And Lanier.
Hi, my name is Lanier Antoinette. I'm a cognitive behavioral weight loss therapist, and I primarily deal in relationships and weight loss.
Awesome. Thank you for being here.
Thank you.
To go ahead and start off the exploration, I thought we would pick on the doctor here.
Of course.
And just get any new tips in sex. You do work with a large number in the homosexual community as well. So I feel like you can also talk to us and educate us on that. Any tips, any products, lubes, anything that might be of value to any of us in the sex realm?
Of course. I mean, certainly for all partners involved, whether it's two people, threesomes, group sex, however many, it's always important to have communication. That's certainly going to enhance the experience. So speaking of lubes as well, I'm very particular about the types that I may recommend. Things to look for, like parabens, phthalates. Those are the ones you actually want to stay away from, because those could actually disrupt those same hormones that could really help with libido. So say if someone does have low libido or they're just not as interested, there may be other health concerns, but hormones are usually part of the picture as well. So really just being able to make sure that the lubes are of really good quality, more natural, and then also just safe sex.
Yeah. So it does benefit to spend money on lubes. The more expensive lubes, I recently...
Just to make that investment versus maybe something you grab at the dollar store, because then the worst part is like you're ready to get in the mood. You put it on, put it in, whatever you need to, where it's going.
Yeah.
Rashes, maybe someone has an allergic reaction, so it's not going to be really sexy taking someone to the doctor.
Dollar store lube, big no-no. But sounds really scary, actually.
Yeah, so definitely weighing that piece. So there are a number of them out there, at least that now as we are getting more natural, and honestly even coconut oil is just a great,
that's
we
fantastic.
could even use that internally as well.
My mom would love you right now. She's always going on and on about her coconut oil. It's just good for everything. Oh, and Mom uses it. So here we have somebody that actually does use it for sex, and it is great, huh?
Great. It's great
Yeah.
for sex, great for the hair, great for the skin, it's
Oh.
everything.
You sound like my mom. We should put the two of you out for coffee or drink sometime.
And actually, you know, for women, especially postmenopausal, or you know, or in general, if they do have issues with lubrication, or especially afterwards once the hormones decline, vaginal dryness, just open up a cap of vitamin E and probiotics, and kind of doing a whole regimen around that.
Wow.
That will help as well.
Wow. When you say open up a cap of probiotics, does that mean like that comes in liquid form?
Oh, the cap of vitamin E. It's like usually it's
okay.
a gel cap, so you could like even just puncture the cap and and move and on your finger and move it around up there, or you could even just put the capsule intravaginally.
Down there.
Yeah, and so it's this vitamin E is just very healing. Like you could even put it on wounds, and so so that's what used to be done as well.
I'm proud to say I'm not there yet, where I don't have experienced these dryness problems quite yet. Thank goodness. For now, at least. But I'll always remember this then.
Yeah. Versus I know it's like or they want to go right to hormones, and it's like okay, well there's more we can do. Before jumping right to hormones, which also can really fluctuate our own internal hormones, and there's definitely ways going further up the spectrum that may not be as
I love
big
how
for
your
the body
doctors
to-
are so comfortable with the word hormone. The word hormone scares me a little bit. Scares Dr. Love even so till this day. I'm not ready to start thinking about my hormones quite yet, but I know it's important.
Right.
It gets to that point. And so let's move over to Lam here. And, part of the reason I really wanted to talk to you today was, I have recently been presented with straight male clients and friends, and even in my personal life, who have had experiences with transgenders. But they consider themselves straight still. So even if a straight client of mine or a straight friend of mine has an instance with a transgender person, they still, hands down, consider themselves a straight man. How do you explain that to us? Because I'm having a hard time grapple that.
For me, gender and sexuality are two different separate things. And for a trans woman, they see themselves as women, they present themselves as women. And for a man dating them, they see transgender women as women. So by dating them and going out with them, they would still consider themselves straight. I mean, imagine myself going out with a transgender man. I would still be as gay as possible. I mean,
because he would be a man. And
right, it's not really to the point. It's that, in my perspective, I think it's not all comes down to genitalia. It's all come down to how they present themselves to the world.
Sure, and that's what I'm having a hard time. Like, if there's a penis there, and if I was a man, it would still make me feel somewhat, at least, bisexual. But what I'm fascinated by is that I'm meeting more and more in the younger generation, straight men who are dating a transgender female, and usually they are taking hormones. So I agree with you, there is a lot of, with the hormones, they are really becoming female. But there'll still be a penis there, and it's kind of that skeleton in the closet. Like, how do you take that out of the equation? So are you saying more so energetic? You just look at the energy of the person?
I would say so. I would really say so, because I understand that a lot of people would not be able to be comfortable with the whole transgender thing, and that's okay. I actually think that's okay. And then it takes guts to date a transgender person.
Yeah, I think it's great that your generation, the younger generation, who are, you know, who I consider just the angels of the universe right now that are transforming old mental and social structures that really have inhibited a lot of us older generation. I think it's great. I would like to experience dating a transgender myself and see hands-on how I feel about that. Because to me, I'm fascinated by it, but I think it's great that a lot of these younger guys can date a transgender woman and really treat her as a woman because she feels like a woman. She really does feel that. Yeah.
And then the sex, sure, it could be a bit different, but it's a whole new level of experience.
Yeah.
And, you know, we live in 21st centuries. There's nothing to be ashamed of.
I love that. I second that 100%.
And actually on a more historical note, so way back in the day, which in a way wasn't that long ago, especially, you know, if they have a female, or, you know, babies being born and the clitoris was too big or maybe the penis was too small, the doctors would actually ask the parents, like, which way do you want the baby to go?
Wow.
So then after, you know, so now the kid's growing up and they could be growing up in a very different gender than maybe what they internally felt. So this could have even been going on way back when. It just wasn't very talked about. Because there's also a number of disorders where, you know, if certain genes get turned on or turned off, they could actually have testes inside but have an all-female body. So there has been, you know, this is not in a way the first time we're hearing this, so to speak. It's just, I'd say the first time it's really out there, and now for many different pieces. Because we have sex, which is our chromosomal DNA, and then the gender is, you know, how we feel and how we move and who we like. And
Right.
Well, I'm gonna revisit this with the two of you in a moment about how I can be a straight woman and put a penis on and have sex with my boyfriend if I wanted to, anally. I want to explore this. That's why I have this show, so I can learn this stuff. So I'm going to revisit you two experts on that topic in a moment. But right now, I want to speak with Lanier here. And I'm very interested in this new business that Lanier has to help women and men in regards to their bodies, and it ties in with their sexuality. So I want to hear more about that. Tell us about your career.
Well, I really get into digging deeper psychologically because no matter what we're doing, especially sexually and in our love life, it has to do with what's going on in your head. A lot of sex is mental and, you know, and physical. So the better you feel about your body, of course, you know, you're going to be walking past the mirror going, oh, check me out. You know, the guys who might be losing a little bit of weight and, you know, the first time they're seeing their muscle, they're running over to me like, hey, feel this. You know, they want to show that off, you know. And you know, as we age and put on weight, for men especially, testosterone levels lower. And we're seeing more and more ED and, you know, erectile dysfunction and that sort of thing, and diabetes. You know, all of that plays a role in blood flow. So even as low as a 5 or 10% reduction in your weight, you're going to see some of these issues resolve. So all of a sudden, that man, he's going to start really feeling good. You know, he's going to be chasing his woman around the bedroom again. You're going to start seeing him feel pretty good.
That's always wonderful.
Absolutely. You know, we want that. We want to be going, yo, come on over here, big boy. And for women, it works the same way. As they're losing weight, and especially as they exercise, you see more blood flow to the pelvic area. So that's, we're talking easier stimulation, because we were talking about lube and that sort of thing. And for some women, even more orgasms. So you definitely want to keep your health and, you know, your weight in check as, you know, you're working on that. So I work with people in that so that they're feeling better about themselves and their love life.
It is all interrelated. It really is. If we don't feel good, I think it's hard to make somebody else feel good overall, and much less ourselves if we're already not feeling it anyways. And once you start getting sexual,
and you have to love yourself.
It is interrelated.
You know, in order to be wanting to love somebody else and love somebody else's body and your own body. So.
Well, we'll revisit into some darker realms of love since that you're here and I get to pick your brain about that and you can educate, because I do believe there is something that you can teach us all, and we'll come back and revisit. After I pick on Serena here about this threesome, I just found out in the Uber on the way over that you've engaged in a threesome previously, Doctor.
Yes.
Tell us about that, or any tips that you can offer in regards to that. And I really must know, was it a two-man doctor threesome, or was it a three-women threesome? I want more details.
Yeah, actually, the one was with two men, one was with another woman.
Oh my! I never.
Oh my God, this was years ago. And I will say that at least I knew the people. So that's so you know, again, it's something right, and there was protection, and you know, so at the end of the day, it's like there's actually a number of STDs that we may not even feel or get any symptoms for, and especially if, you know, because I am someone too who would want to get pregnant and have kids sometime in the future, that especially if these are left untreated, you know, they could totally destroy our reproductive system.
Sure.
So that's, you know, or especially if you do engage with people that, you know, maybe you don't know, and it's, you know, one night stands, you don't even remember what happened when you wake up in the morning, and you see all the empty alcohol bottles, because I know that could happen too.
It's been a while for that.
Yeah, go to your doctor and get tested. I believe now they even just do urine tests, so it's not even or even blood tests for some of them. So it's not even a more invasive.
So we can do a urine test and figure out if there's any diseases floating around these days. Wow, technology has really gotten up there.
And especially because some of them are bacteria, like chlamydia, gonorrhea, and syphilis are still the top three. And like gonorrhea, you may see symptoms, potentially syphilis, but chlamydia can go asymptomatic, and especially for women. So for, you know, where men may see some penile discharge, for women it could be like, oh, maybe I'm just at a certain time of my cycle, and that's why I'm getting a little discharge, and we won't even think about it.
Interesting.
Yeah.
And you know, since I'm always on my own explorations, and I've always thought about having sex with other women, interestingly enough. Is it easier to spread diseases between two females more so than a heterosexual couple?
I don't think so. I mean, because, you know, there's really no stigma or stereotype to who could be carrying something around, especially something like herpes, which could easily stay dormant. And it's, you know, there's still the taboo of, yes, well, it is kind of a touchy subject, but like whether you're really required to tell your partner in a way you are, but, you know, who really wants to, who wants to admit that, you know, maybe this has happened. And especially something like herpes, which in a way, which doesn't really go away per se. Like it could stay dormant for a period of time, or sometimes it comes out as shingles. And it's not like, okay, it's just, you know, herpes on just oral and genital. It's more like, it's 80% of them, because you could still get oral herpes in the genital area and vice versa. So that could be too, like going down on a woman, maybe if there's open lesions and so forth. That's just a, you know, easy for disease to get
easy
through.
No. If there's an open lesion on anyone that you're exploring with, I would definitely say steer clear of that.
Right, so that's where, you know, like dental dams, condoms, whether it's female or male condoms. And then I know, even in the heterosexual realm, you know, there's all the contraception, but that's more along the pregnancy line. That's not going to protect you from STDs.
Let's talk about the female condom.
Yes.
I've had a lot of questions on that. That's something the woman inserts inside of her, and it lines her insides.
Correct.
And so when the penis enters, it's not actually touching the sides of her, correct?
Because it's just all, you know, it's all there, so to
And
speak.
how easy to apply are they?
It's pretty easy. It's, you know, not too bad. you know, it's pretty straightforward, you know, kind of like the male condom.
Sure.
But certainly for women too, there's many other different types if they, you know, prefer, you know, there's also like the cervical cap, the diaphragm, which, you know, will at least cover the cervix, you know, for any sperm to get through. But, you know, once again, I think at the end, it's also just, you know, are you in a monogamous relationship? You know, when was the last time either you or your partner were tested? You know, depending on the different options, because I've also heard that the female condom isn't as popular or the most desirable one to be used.
I wonder why. I think that it's something that all us women should explore a little bit more. And I would wonder if it's more pleasurable for the man, because the man then doesn't necessarily have a cover onto him, whereas with us women, we don't really feel it.
What I hear from men is that they just want to feel the walls. So the fact that now there's something again blocking the wall, well, now they're just as pissed off.
Men just want to feel the walls? I love men just wanting to feel my walls. I like that. Is that what you hear from your patients? I really like that. I want to feel my walls.
You know, they want it bare. They just, you know, nothing there, kind of that primal instinct. Because I've also heard from many women, just like some will feel the difference, some won't. And then it's, you know, at the end of the day, if the guys are like, well, you know, I don't want to feel anything, they're like, okay, what do you want to name our kids? You can't see them reach for the condom fast enough. So
Right, sure. Let's go over into some gay sex, which always fascinates me. The whole topic of, obviously I'm going to be talking about men, but I'm also wanting to explore, do women have a top and a bottom? How does that work? Like with women when they're together, I guess the sex realm, I do watch lesbian porn, there's a lot of scissoring going on, which I find extremely sexy, the whole scissoring thing. So, Alam, I don't know if you would know about lesbian sex necessarily, but is there a top and a bottom for women?
Is there a top or bottom for women? I would say, in a way, more like a masculine energy or a feminine energy, or who want to be dominant more.
Okay.
Right.
So it's back to that energetic dominance of the masculine energy per se. So would that woman be the top of the scissors or what?
Well, I don't think lesbian necessarily like scissoring, because a lot of my friends told me that is not really that pleasurable.
Oh, really?
No, really.
So what do they like? Like strap-on?
Some of them, some of them like it. Some of them doesn't want anything insert in them. Some of them like to go down on their partner, or the partner go down on them.
Like a lot of oral.
Yes, and then there will be involved of fingering, you know, and they can explore with toys and strap-on, as you say, if they want to.
Sure. And what about for men? Does it seem like there's often a top and a bottom for men, or is it more interchangeable? Because I don't think the homosexual world really understands that concept of the top and the bottom. When men are considered tops or bottoms, is it a strict rule? Are they always a top or a bottom? Is it fluctuate, or is it always not so cut and clear?
I will speak for my generation and experience.
Okay.
I would say there are some men who would consider themselves as strictly top or bottom, and I used to be strictly bottom, like no question.
God bless you.
Yes. However, as I grow older and then I talk to a lot of people, a lot of the men who involved in homosexual relationship, they would be versatile.
Right.
They would
That's
switch
been
it up,
my experience.
and it's fun that way.
And I love that. I kind of aim for that with my own sex life, to be quite versatile. And so my boyfriend might get upset, but I want to explore, I want some lessons from the two of you on how I can put on a strap-on and what else I would need in order to do that to my boyfriend if I ever so chose to. But also, before we end, I do want to go into a little bit of a dark realm that Lanier experienced with an ex, because I think it would be of value to any women who are feeling worried that there might be some conning going on in their love lives, because Lanier unfortunately was conned by her immediate and favorite sexual partner of over 5 years. So tell us a little bit of what are some warning signs so we can all make sure to look out for and then run from a situation that could go ugly.
Whether you're a man or a woman, if your partner is asking you to invest or for money, and you know, it looks normal, it looks like it's for your future, but if it's moving too quickly, there is no deal that is on fire, that can't wait for a lawyer to be present or paperwork. And love isn't subjective, so you want to trust that person, and of course you should. But in this day and age, when you're going to get married and you have to sign the prenup, don't think that it's wrong to protect yourself just by asking for simple paperwork. And remember that if that person loves and cares about you, they will love and care about your finances. And they're going to protect you. And even like when we're talking about protection and condoms, the person who wants to be with you is going to protect you no matter what, whether it's your finances or your body. And look for that. And if somebody is pushing you for your money or your body, no matter what it is, take a step back and really reevaluate and get some legal advice, because it doesn't take long to lose everything that you have. And these people are so good at what they do, and they wrap everything up in a lie. So not only then do you lose your money, but you lose your self-respect, you kind of lose yourself in all of this. So also I tell people to get help, because a lot of times it's very confusing and scary.
I'm all about lawyers. I love attorneys, and I love paperwork, and I love prenups. And before I close, the whole real reason I wanted to do this show today was to learn a little bit about how I can put a strap-on. My boyfriend is going to be watching this, probably totally mortified, but I want to know, what do I do to buy myself a strap-on, and what do I need to put on it to insert?
Oh, definitely lots of loops on your boyfriend.
We did recently buy very expensive lube.
And the strap-on, and you need to help him loosen it up back there.
Oh, how do I help him do that?
Either with a small sex toy, or with finger, and then start from one finger and go from there until, you know, it's pleasurable.
Interesting.
Yes.
And the man's prostate, as we all know in 2017, is something that should be massaged regularly. This has come out, and maybe you can finish us off on the health tip on that.
No pun intended.
I've heard that it should be massaged regularly, is where the medical community stands on the male prostate. Is that correct?
Yes.
Okay.
Yeah, it's a
That's
good
enough.
way to get things going.
Thank you so much for joining us on this episode, and we'll see you next time on the Dr. Love Show.